Do and don't Captain modifiers. Modifier 24. Ask yourself the question, would I be treating this problem if they never had the surgery? If the answer is yes, append a 24 modifier and bill the visit. Be careful not to confuse modifier -24 with modifier -79 unrelated procedure. Modifier -24 is appended only to evaluation and management EM codes. Use an appropriate diagnosis code show the visit wasn't related to the surgery when you use modifier 24 unrelated EM service by the same physician or other qualified health care professional during a postoperative period to report an EM visit following a surgical procedure on the same day. Use modifier 24 during a surgical global period to report an unrelated EM service. Modifier 25. The EM service may be prompted by the same symptom or condition for which the procedure and/or service was provided. As such, different diagnoses are not required for reporting the EM services on the same date. This circumstance may be reported by adding modifier -25 to the appropriate level of EM service. This modifier is not used to report an EM service that resulted in a decision to perform surgery, instead see modifier -57. For a significant, separately identifiable non-EM service, see modifier -59. When appending modifier -25 to a significant, separately identifiable EM service on the same day as a procedure, the evaluation and management EM service must document well the key elements of history, examination, and medical decision-making. Modifier 26. Check with your carrier to determine its local policy for proper use of modifier -26. Modifier 27. Modifier -27 is not to be used for physician or other qualified health care professional reporting of multiple evaluation and management EM services performed by the same physician on the same date. For physician reporting of all outpatient EM services provided by the same physician on the same date and performed in multiple outpatient settings, e.g., hospital emergency department, clinic CEM, emergency department, or preventative medicine services codes. Modifier 32. Keep in mind that modifier -32 is not for situations when the patient, family members or other parties request second opinions or other services. Two of the more common instances in which you may utilize this modifier are: 1. When a workers' compensation carrier sends a patient to a provider seeking a second opinion. 2. When children in state custody are sent to a physician for health examination after being placed in temporary custody or foster care. Modifier 33. For separately reported services specifically identified as preventive, the modifier should not be used. If a code specifically describes a preventive service covered under the ACA, e.g., a screening G-code, modifier -33 should not be necessary, though you should verify that with your payers. Modifier -33 allows you to flag preventive services such as glaucoma or diabetes screening to distinguish them from diagnostic tests that use the same Captain codes. Remember to check the patient's insurance coverage policy to make sure he/she is eligible for the particular preventative service to which you plan to append modifier -33. Under the Affordable Care Act (ACA), all health insurance plans are required to cover certain preventive services and immunizations without a copay or deductible. You also should not need to add modifier -33 if the code describes a service that is an inherent part of the ACA, such as immunizations. Modifier 47. Modifier -47 does not describe local anesthesia administered by the surgeon. Modifier -47 would not be used as a modifier for the anesthesia procedures. Modifier 50. To prevent modifier 50 denials, ask your clinicians to indicate the anatomical side they work on. Do not use modifiers RT and lieutenant when modifier -50 applies. Modifier -50 is not applicable to procedures that are bilateral by definition, or their descriptions include terminology such as bilateral or unilateral. Modifier 51. This modifier should not be appended to designated add-on codes. Modifier 52. For hospital outpatient ambulatory surgery center (ASC) reporting of a previously scheduled procedure, service that is partially reduced or cancelled as a result of extenuating circumstances or those that threaten the well-being of the patient prior to or after administration of anesthesia, see modifiers -73 and -74. Modifier 53. For outpatient hospital ambulatory surgery center ASC, reporting of a previously scheduled procedure, service that is partially reduced or cancelled as a result of extenuating circumstances are those that threaten the well-being of the patient prior to or after administration of anesthesia. See modifiers -73 and -74. This modifier is not used to report the elective cancellation of a procedure prior to the patient's anesthesia induction and/or surgical preparation in the operating suite. Modifier 55. Per guidelines, report the date of the surgery and the date you took over on the CMS 1500 form to get the correct reimbursement. Modifier 56. Check with each individual payer for specific split care rates and applicable modifier usage. Modifier 57. Use modifier 57 to report the decision for surgery EM. Modifier 57 indicates that the initial decision for major surgery occurred during the EM visit. Do not report pre-op EM services with modifier -57. With pre-op visits, the decision for surgery already has been made. Scheduled pre-op visits are included in the global package. This modifier technically should be used only when the surgery being discussed qualifies as a major surgery 90-day global period. For minor surgical procedures, see modifier -25. Modifier 58. For treatment of a problem that requires a return to the operating or procedure room, e.g., unanticipated clinical condition, see modifier -78. Modifier 59. Report a diagnostic service with modifier 59 when the doctor bases the decision to perform a therapeutic procedure on a diagnostic service and all three of the following conditions describe the diagnostic service. It takes place before the therapeutic service and is not interspersed with services for the therapeutic service. It clearly provides information the doctor needs to determine whether he will perform the therapeutic service. It would not normally have been required during the therapeutic procedure. Report a diagnostic service that takes place after the therapeutic procedure when conditions 2 and 3 apply. Modifier 59. Modifier -59 should not be appended to an EM service. To report a separate and distinct EM service with a non-EM service performed on the same date, see modifier -25. Only use modifier -59 if no more descriptive modifier is available, and the use of modifier -59 best explains the circumstances. Modifier 62. Each surgeon should report the co-surgery once using the same procedure code. If additional procedures, including add-on procedures, are performed during the same surgical session, separate codes also may be reported with modifier -62 added. If a co-surgeon acts as an assistant in the performance of additional procedures other than those reported with modifier -62 during the same surgical session, those services may be reported using separate procedure codes with modifier -80 or modifier -82 added, as appropriate. Modifier 63. Modifier -63 should not be appended to any captain codes listed in the Evaluation and Management Services, Anesthesia, Radiology, Pathology, Laboratory or Medicine sections. Unless otherwise designated by Captain Appendix F, modifier -63 may be appended only to procedures, services listed in the 20005-69990 code series. Modifier 73. Do not use modifier -73 to report the elective cancellation of a service prior to the administration of anesthesia and/or surgical preparation of the patient. For physician reporting of a discontinued procedure, see modifier -53. Modifier -73 is for ASC use only. Modifier 74. Do not use modifier -73 to report the elective cancellation of a service prior to the administration of anesthesia and/or surgical preparation of the patient. For physician reporting of a discontinued procedure, see modifier -53. Modifier -74 is for ASC use only. Modifier 76. Modifier 76 repeat procedure doesn't allow you to unbundle edits. Modifier -76 should not be appended to an EM service. Only append modifier -76 for identical services done by the same physician-clinician. Remember that Medicare defines same physician as any physician of the same specialty in the same group. Use modifier -77 for identical services by a different provider. Modifier 77. Modifier -77 should not be appended to an EM service. Modifier 78. For repeat procedures, see modifier -76. Modifier 79. For repeat procedures on the same day, see modifier -76. Modifier 91. Modifier 91 repeat clinical diagnostic laboratory test should be used when the provider needs multiple tests on the same day to treat or diagnose the patient. Modifier -91 may not be used when other codes describe a series of test results, e.g., glucose tolerance tests, evocative suppression testing. Modifier -91 may not be used when tests are rerun to confirm initial results due to testing problems with specimens or equipment, or for any other reason when a normal, one-time, reportable result is all that is required. Modifier -91 may be used only for laboratory tests performed more than once on the same day on the same patient.